Welcome back. In today's Medical Moment, brought to you by East Jefferson General Hospital, we learn about state-of-the-art technology that is making colon surgery less invasive for some patients. Here's Camille Whitworth.
We now know that about 200,000 people are diagnosed with colon cancer every year, and 50,000 people die from it. Well, here at East Jefferson General Hospital, we are working to change that outcome. Dr. Matthew Zelhart is a surgeon here at the hospital. He tells us about a new procedure and a new treatment that is called Arise, and he's using it to change patients' lives.
If you had a pre-malignant lesion, you had a surgery as if you had cancer already. So that would involve taking out sometimes half your colon, sometimes your rectum, sometimes needing a bag. And now that we're better at screening, finding these lesions earlier before they actually develop into a cancer, we're able to develop new techniques, use the Arise technology, use the Da Vinci robotic technology, and we're able to remove these lesions, sparing the colon, minimal to no incisions, and patients go home same day or the next day, usually back to work in 2 days, and little to no pain. So Arise encompasses two new technologies. The first one is a gel, and it is a liquid when we inject it, and we inject it underneath these pre-malignant lesions to separate them from the wall of the colon or rectum. And when that liquid hits the tissues, it turns into a gel, and that allows us to use advanced surgical endoscopy to cut out these lesions through a typical colonoscope. The second part of Arise is the tissue retraction system. So the hard part about operating with a colonoscope alone is that you're injecting air into this organ, and so the tissue billows like this. So it's almost like operating while on a boat in the ocean. This tissue retraction system expands around the polyp or the pre-malignant lesion and has two arms that come out. So we have retraction as well as the knives that we use through the colonoscope to remove this lesion all in one piece.
So this is literally night and day for both the patient and for the surgeon.
Oh, there was no previous before. This technology did not exist, and things like this did not exist. The Arise retraction system has been approved by the FDA for a few months now, and the gel was just approved a few months before that.
And the results. Tell us about the results.
So patients are doing fantastic. We've done about 20 patients with our advanced surgical endoscopy using one or both of these Arise technologies, and we're seeing patients go home the same day or the next day, little to no pain. They're usually back at work in about 2 days.
So how prevalent is colorectal cancer these days?
So we know that the rates of colon cancer are increasing in patients in their 30s and 40s at a dramatic rate. People that were born in the 1990s have a 2-fold increase in colon cancer and a 4-fold increase in rectal cancer. And so we're starting to modify our screening protocols to start encompassing this patient group. And now that we're doing that, we're able to find these lesions before they actually turn into a cancer. So the first step is awareness. And colon cancer and rectal cancer are predominantly a silent disease. That's why getting colonoscopies is so important. Most patients don't have any symptoms as a cancer is starting to develop. And so screening for these silent diseases is absolutely paramount in prevention.
Doctor, this is making a huge change in people's lives. How does that make you feel?
I think that advanced surgical endoscopy is the forefront, and more and more procedures will be able to be done through a colonoscope with minimal to no incisions, and I think the Arise technology is the first step on a very exciting new field ahead of us. So what this means to me as a surgeon is that I can take a patient, prevent a cancer, and get them back to their normal life in 2 days without removing half of their organ.
So how new is this? Well, the doctors here at East Jefferson General Hospital are the first to use this combined technology. Not only is it great for them, but it's also great for you, the patient. I'm Camille Whitworth. Thanks for watching.
All right, if you'd like to learn more about this new procedure or anything else health related, log on to EJGH.org.